Everybody, we've got another heart today. This is number 619 in our collection. The heart would have sat in the chest like this, anterior surface here, posterior towards the turntable, superior head here, inferior legs here, left over here, and then right over here. Right off the bat, just looking at this heart externally, we can see we'll probably be dealing with the vascular ring, but we'll get to that later. We'll start off as we normally do, which is by trying to locate what at least externally appears to be the right atrial appendage. And here we see an appendage that's triangular or broad-based or pyramidal, so consistent with what we would expect to at least externally be a right atrial appendage. So we'll go ahead and open up the heart there. And when we open up the heart there, we do see pectinate muscles that spill outside the confines of the appendage, consistent with the morphologic right atrium. You can see more pectinate muscles over here. And then here you can see the oval fossa, and there does appear to be a defect in the oval fossa, right here by my finger. And then we also do find the coronary sinus here. And remember, the coronary sinus, the tendon of Todaro, and the right-sided atrioventricular junction form a triangle known as the triangle of Koch, and at the apex of this triangle, bounded by the coronary sinus, the tendon of Todaro, and the right atrioventricular valve, at its apex is where we expect to find the atrioventricular or AV node. So we would expect the AV node to sit approximately here. When we look at this right-sided atrioventricular junction, we do find a right-sided AV valve that appears to have 3 leaflets, 1, 2, and 3. So here's the anterior leaflet, septal leaflet, and then inferior leaflet of what we presume is a tricuspid valve. There are connections to the ventricular septum here, consistent with a morphologic tricuspid valve. When we go ahead and look at the actual ventricle itself, there are coarse trabeculations, and we do find that there is a septomarginal trabeculation, and that's right here, all consistent with the morphologic right ventricle. We also see that the ventricular septum is intact. We get into a semilunar valve here, and you can see the semilunar valve has 3 leaflets, 1, 2, 3, and it does have 3 sinuses as well. We'll try to look down on this. There are no coronary arteries arising from within these sinuses, and this is completely muscularly supported, all consistent with a pulmonary valve. And here, in fact, is the pulmonary trunk that's giving rise to the branched pulmonary arteries. And as we follow this pulmonary trunk, we do see that there's also a patent arterial duct, which we'll look at in more detail a little bit later. Let's go to the back side of this heart. So here's the posterior aspect of this heart. Let's go ahead and find the second atrium. And here it is. We find a smooth-walled atrium consistent with a morphologic left atrium. Now you can also see the oval fossa interatrial communication. And here is the mouth of the left atrial appendage. We do find a left-sided atrioventricular valve as well. This valve appears to have 2 leaflets, 1 here and 1 here, and it does not appear to have any connections to the ventricular septum, so consistent with the morphologic mitral valve. This ventricle it's opening up into has fine crisscross trabeculations, consistent with the morphologic left ventricle. And then the outflow of this ventricle is in fact into an aorta, which is right here. And we'll follow this aorta around. As we follow this aorta, it does appear to be a right arch. So here's the ascending aorta. And then if we look at the head and neck vessels, let's try to get those situated and sorted out. It does appear to be a right aortic arch with mirror image branching. So here is the left brachiocephalic. This appears to be the right carotid. And let's see if we can find the right subclavian. It might be a little tricky to find. Let's see. All right, so here's the left brachiocephalic. Here's the right carotid, and then back here is the right subclavian. Here is the transverse arch. And then here's the descending aorta. And now when we look, we've got the esophagus and trachea in our hand here. If we swing this around, we do see that there in fact is a ring here that is formed by the arterial duct and the aorta here. So let's go through this aortic arch anatomy one more time. Here's the pulmonary trunk. Here's an arterial duct here. Then here is the ascending aorta. And now when we get all the head and neck vessels exposed, here is the left brachiocephalic that's coursing anterior to the trachea and anterior to the esophagus. Here is the right carotid, and here is the right subclavian. Then this right-sided arch continues, and here's the descending aorta. But then here is the arterial duct that inserts into the aorta, forming a ring around the esophagus and the trachea. So here's the esophagus, and here is the trachea. So we've got a heart with oval fossa intraatrial communication, as well as a vascular ring consisting of a right aortic arch with mirror image branching and an arterial duct.